Okay, Justice Ginsburg said very powerfully, very strongly, at some point, 10 years ago or so, she said a president and the Senate is elected for a period of time, but a president's elected for 4 years. We're not elected for 3 years. I'm not elected for 3 years. So we have the Senate, we have a president.
He's elected to the next
during
election.
that period of time, we have an opening. I'm not elected for 3 years. I'm elected for 4 years. And the 100 million people, Joe, the 100 million people is totally wrong. I don't know where you got that number. The bigger problem that you have is that you're going to extinguish 180 million people with their private health care that they're very
That's
happy with.
That's simply not true.
Well, you're certainly going to socialist. You're going to socialist medicine.
We're now into, gentlemen, we're now into open discussion.
Open discussion.
Open discussion. Yes, I agree. Go ahead, Vice President.
Number one, he knows that what I proposed. What I proposed is that we expand Obamacare and we increase it. We do not wipe any. And one of the big debates we had with 23 of my colleagues trying to win the nomination that I won, were saying that Biden wanted to allow people to have private insurance still. They can. They do. They will under my proposal.
It's not what you've said,
but
and it's not what your party has said.
That is simply
your party
a lie.
doesn't say it. Your party wants to go socialist medicine.
My party is
and
me.
socialist
right
healthcare.
now. I am,
and
the
they're going to dominate
party.
you, Joe. You know that.
I am the Democratic Party right now. The platform of the
Not
Democratic Party
Harris.
is what I, in fact, approved of. What I approved of. Now, here's the deal. The deal is that it's going to wipe out pre-existing conditions. And by the way, the 200,000 people that have died on his watch, how many of those have survived? Well, there's 7 million people that contracted COVID. What does it mean for them going forward if you strike down the Affordable Care Act?
Joe, you've had 308,000 military people dying because you couldn't provide them proper health care in the military. So don't tell me about this.
I'm happy to talk about this.
And if you were here, it wouldn't be 200. It would be 2 million people because you were very late on the draw.